In this episode of the Huberman Lab podcast, host Andrew Huberman interviews Dr. Vivek Murthy, the U.S. Surgeon General. They discuss various topics related to public health, including nutrition, obesity, food additives, mental health, loneliness, and the role of corporate interests in public health policy. Dr. Murthy explains that the role of the Surgeon General is to provide scientific information on how to improve health and reduce the risk of illness and injury. He also oversees the United States Public Health Service, which consists of 6,000 dedicated public health officers who work to protect the nation from public health threats. One of the main issues discussed is the importance of focusing on overall health, not just the absence of illness. Dr. Murthy emphasizes the need to optimize physical and mental health, rather than solely focusing on preventing and treating diseases. He believes that prevention and health communication should be given more attention and resources in order to help people stay well. The conversation also touches on the challenges of effectively communicating public health messages to the general public. Dr. Murthy acknowledges the need for a comprehensive and efficient way to reach everyone with important health information. He mentions the limitations of traditional media and the importance of utilizing online channels and partnerships to disseminate messages. Dr. Murthy highlights the issue of highly processed foods and the additives and sugars they contain. He expresses concern about the impact of these dietary practices on people's health and well-being. He also mentions the challenges faced by individuals in low-income neighborhoods who may not have access to fresh and healthy food options. Throughout the discussion, Dr. Murthy emphasizes the importance of data and evidence-based decision-making in public health. He mentions the need for more research on the health impacts of food additives and the importance of addressing the underlying factors that contribute to unhealthy dietary practices. Dr. Murthy continues by highlighting the influence of processed foods on our health. He mentions that in the past, these foods were not readily available or allowed in his household, but now they have become a significant part of the American diet. He emphasizes that the brain can be rewired through neuroplasticity when people consume high-sugar and high-savory foods, leading to increased appetite and reduced satisfaction from healthier foods. While these studies do not directly link these foods to cancer, Dr. Murthy questions the need to wait for extensive clinical trials before taking action to address the potential health risks associated with these foods. He raises the issue of who sets the thresholds for food safety and why there is a delay in taking action to protect public health. Dr. Murthy suggests that a cautious approach should be taken, and the public should be informed about the potential risks of consuming more than 15 to 20% of these processed foods. He believes that everyone should have the opportunity to make informed choices about their diet and calls for clear and accessible information to be provided to the public. Dr. Murthy acknowledges the complexity of the challenges in promoting public health and the need for objective scientific authorities to guide decision-making. He mentions the importance of having scientific evidence and long-term data to support recommendations and to address concerns about additives and other products in food that lack sufficient research on their health risks. He also highlights the influence of food companies in promoting their products and the need to balance their profit motives with public health considerations. The discussion then shifts to the issue of trust in public health initiatives. Dr. Murthy acknowledges the erosion of trust in institutions and the need to rebuild it. He emphasizes the importance of transparency, clear communication, and humility in public health messaging. He acknowledges that mistakes can be made, but it is crucial to learn from them and adapt recommendations based on evolving data. He also highlights the challenges faced by public health officials who have been subjected to abuse and threats during the pandemic, which has further hindered effective communication and response. The conversation then turns to the topic of masks and the challenges faced in messaging around their use during the pandemic. Dr. Murthy acknowledges the initial confusion and changing recommendations regarding masks but emphasizes the importance of clear and transparent communication. He acknowledges the difficulty of delivering nuanced information in a time when there is no clear black and white answer. He also highlights the need for humility and empathy in understanding different perspectives and concerns, particularly regarding mask mandates in schools. Dr. Murthy continues by expressing his concerns about the future and the need to build trust and unity in the face of future health crises. He emphasizes the importance of effective communication, acknowledging and addressing concerns, and fostering an environment of humility and civility. He believes that these principles are essential for rebuilding trust in public health institutions and ensuring a unified response to future challenges. Dr. Murthy continues by addressing the COVID-19 pandemic and the importance of vaccines in controlling the spread of the virus. He emphasizes that vaccines have been extensively studied and are safe and effective. He acknowledges that there may be rare side effects, but compares them to the side effects of other commonly used medications, such as Tylenol and ibuprofen. He cautions against basing decisions on anecdotal evidence and highlights the need for clear communication, empathic listening, and data to address vaccine hesitancy. He also discusses the need for diverse voices and perspectives in public health initiatives. He suggests the formation of small, diverse committees to provide recommendations and guidance, rather than relying on individual experts. He believes that diverse voices are important in reaching different communities and building trust. He mentions the Community Core Initiative, which brought together a diverse group of people, including community leaders and healthcare professionals, to disseminate public health messages. Dr. Murthy acknowledges the concerns about the relationship between the pharmaceutical industry and public health initiatives. He emphasizes the importance of independence and transparency in medical advice and public health recommendations. He acknowledges the history of doctors being influenced by pharmaceutical companies and the need to address this issue. He believes that decisions should be based on scientific evidence and patient needs, rather than financial gain. He also discusses the need to focus on behavioral and environmental changes in addition to medication. He believes that society has become too reliant on medications as a quick fix and that more emphasis should be placed on lifestyle changes, such as nutrition, exercise, and sleep. He advocates for an interdisciplinary approach to healthcare, with diverse experts working together to provide holistic care to patients. Dr. Murthy then addresses the isolation crisis, which he describes as a critical public health challenge. He shares his personal experiences of loneliness and isolation and highlights the stigma and shame associated with these feelings. He discusses the decline in participation in community organizations and the impact of modernity and technology on social connections. He believes that social media has replaced in-person connections for many people and has led to a sense of loneliness and disconnection. He emphasizes the importance of addressing the isolation crisis and building strong social connections. He believes that community organizations, faith organizations, and recreational leagues can play a crucial role in bringing people together. He also highlights the need for in-person interactions and the limitations of online connections. He encourages individuals to prioritize relationships and reach out to others, especially during times of loneliness and isolation. Dr. Murthy emphasizes the need for self-esteem and self-belief in order to reach out and build relationships with others. However, social media has had a negative impact on self-esteem, as young people are constantly bombarded with images and messages that make them feel worse about themselves and their friendships. Despite this negative impact, many young people find it difficult to disconnect from social media due to its addictive nature and the design of the platforms to maximize user engagement. Dr. Murthy believes that this excessive use of social media has led to a lack of understanding and wisdom in human relationships. People are talking more but understanding each other less. He highlights the mental and physical health outcomes associated with excessive social media use, as well as the human suffering caused by feelings of isolation and not belonging. He discusses the need for a youth rebellion against these technologies, similar to the rebellion against smoking in the past. He believes that young people can lead the way in putting away their phones and engaging in real-life interactions, which will ultimately rescue us from the negative effects of social isolation. Dr. Murthy provides actionable steps for parents to help their children navigate social media and promote healthy relationships. He suggests delaying the use of social media until after middle school, creating technology-free zones during meal times and before bedtime, and starting a dialogue with children about their social media use. He also emphasizes the importance of leading by example and putting away devices when spending time with children. In addition to addressing the challenges faced by young people, Dr. Murthy acknowledges that adults also struggle with excessive social media use. He encourages adults to set boundaries for themselves and engage in real-life interactions. He also emphasizes the need for policy changes to protect children from harmful content and manipulative features of social media platforms. He calls for data transparency and safety standards to ensure the well-being of children. Dr. Murthy continues by discussing the deeper challenge of disconnection in society and the need to recognize our interdependence and the power of human connection. He calls for a shift in our identity as a society, embracing values of kindness, generosity, courage, and service. He believes that by prioritizing human connection and love, we can create a better future for ourselves and future generations. Dr. Murthy then delves into the role of the Surgeon General and the importance of public health in addressing the nation's most pressing health issues. He emphasizes the need for a comprehensive approach that encompasses not only medical interventions but also social determinants of health, such as education, housing, and access to healthy food. Dr. Murthy highlights the importance of prevention and early intervention in reducing the burden of chronic diseases and improving overall health outcomes. The conversation then shifts to the COVID-19 pandemic, and Dr. Murthy discusses the challenges faced by public health officials in managing the crisis. He acknowledges the difficulties in communicating complex scientific information to the public and the importance of building trust and transparency. Dr. Murthy emphasizes the need for clear and consistent messaging, as well as the importance of addressing misinformation and conspiracy theories. Dr. Huberman and Dr. Murthy also discuss the impact of the pandemic on mental health and the need for increased access to mental health services. They highlight the importance of destigmatizing mental illness and promoting mental well-being as an integral part of overall health. The conversation then turns to the opioid epidemic, another major public health crisis in the United States. Dr. Murthy discusses the role of healthcare providers in addressing the epidemic and the need for a comprehensive approach that includes prevention, treatment, and recovery support. He emphasizes the importance of evidence-based interventions and the need to reduce the stigma associated with addiction. Dr. Murthy also addresses the issue of gun violence and its impact on public health. He discusses the need for common-sense gun safety measures and the importance of addressing the root causes of violence, such as poverty and social inequality. The podcast concludes with Dr. Murthy sharing his vision for the future of public health. He emphasizes the importance of collaboration and partnerships across sectors to address the complex challenges facing the nation. Dr. Murthy calls for a renewed focus on prevention and health promotion, as well as increased investment in public health infrastructure. Thanks for watching. If you enjoyed the video, make sure to like and subscribe.